Hi, thanks for joining us. Today's show, Marquis presents Your Key to Healthy Living. I am your host, Karen Halloran. I'm the Community Liaison for Marquis Health Services. And today I have with us Celeste Begley. She is the Director of Community Relations for Right at Home, Boston North. Thanks for coming on the show today.
Karen, thank you for having me. A joy to be here today.
Excellent. Well, maybe you could tell us a little bit about Right at Home and what you offer.
Absolutely, my pleasure. So Right at Home is a home care agency. We have 3 offices, one up in the Merrimack Valley. We have a flagship office down in Salem, Mass, and we also have an office in Somerville. So we provide private duty home care for those in need, particularly seniors. We do specialize in dementia care, Alzheimer's care, as well as end-of-life care. We provide customized care with clinical oversight, and we've been in business, we've just celebrated our 16th year in business.
Oh, that's awesome. There's a lot of home care agencies out there, and Right at Home is just a leader in the industry. What do you think that you guys do differently than some of the other home cares?
Well, I think what we do a little bit differently is we have, again, when I go back to saying that we have customized care, you know, it's really, we take our clients and we look at all the aspects of a care plan. We start with a clinical assessment, so we ensure that our nurse goes out and visits our client before the start of service. She will do a thorough intake of their medical condition, their physical condition, any limitations. She also does a great job in understanding if there's some cognitive issues or impairment. And then we take that information and work with families to really provide a proper match. We feel the match is as important as the care. And then what happens is when we do start care, our care plans are really thoughtful. They take all that important information, but we also learn a lot about our clients. So our clients can really be care participants versus just a care recipient. So we take the limitations and we enhance on what they can do versus what they can't do. So that's why we like to learn a lot about our clients. Did they work outside the home? Were they introverts, extroverts? If they present dementia, a various form of dementia, we like to learn where they are within the dementia so that we can craft a care plan that can keep them engaged for a positive outcome.
And that's so important.
Yes.
And I know you do a lot of work around Alzheimer's and training, and that's really important that the staff is trained that way. Now, getting into home care, a lot of times people are at the hospital. This is how home care would be introduced to them, because nobody goes really looking for home care until you need it.
Right.
It's not something that you really investigate.
Exactly.
So people find themselves in the hospital, and then they're presented with, you need a home care. How do they choose? How do they even know what's out there, the offerings
What's out
that they
there?
have?
Well, what I can tell you is that we work with a lot of the hospitals and the rehabs and the skilled nursing facilities so that they can have a true understanding of what Right at Home can offer to their patients who may be, discharging from the hospital to a rehab and then to home, or from a lot of times we work with patients that maybe have been seniors that have maybe been admitted to the emergency room with a spouse, and it's the actual caregiving spouse who's been admitted. So we can work with, bringing that spouse home and caring for them. But it's my job to work in the community and to get the word out about exactly what we do, as well as, we're on the forefront of dementia care. And what's great is we offer a certified CEU on dementia, and we do it for case managers, for the professionals, for nursing, for social workers. So we're really, empowering them to learn about all aspects of dementia and Alzheimer's disease, because someone can have dementia but not necessarily Alzheimer's disease.
Exactly.
So we really, and sometimes a dementia care plan can be a little trickier than if someone's just coming home from maybe a broken hip and needing other things. But I think what sets us apart is the fact that the customization that we do and the clinical oversight. I can't say, that is invaluable. Our nurse starts every case and she's in there working with our clients, whether it's the first week of service and continuing, because you know what, care plans change. Our clients' conditions change. So, you know, the change in condition is really important, because as a care plan changes and there's a change in condition, the care plan has to change, and we need to ensure that we're, you know, maybe medications have changed. So that insight, and you know, the nurse makes all the changes to the revisions to care plans.
And I know we work really closely together, Marquis and Right at Home, because one of the things is rehospitalization. So I don't know if everybody is aware as we are, but there are a lot of penalties now for skilled nursing facilities, and soon home care will face it, where they get readmitted back to the hospital.
Sure.
So we're trying to really cut down on that, and I think you do a fabulous job with that.
Yes, so we have, you know, what's really great is we're in a 3-year pilot program with Harvard Medical School, and we are tracking our clients' changing condition, and not only the changing condition, but the outcome of that changing condition. And that's all done through our software system, and what's great about it is our nurse, you know, if our client has a changing condition, our nurse is made aware of it, she has to troubleshoot it, and then she has to provide the outcome. So maybe next year, when we're in year 3 now, so maybe next year I'll invite myself back, or ask to be invited, so I could come back and present to you the findings of the Harvard study. But to talk a little bit about hospital readmissions, what's really great too is that we have the ability to track our client if they're coming out of a, you know, Marquis community, if they're within their 30-day window, we can alert, you know, test them in our system, and then if they are symptomatic or having, you know, difficulty, my nurse can troubleshoot it, call the physician, you know, we can call Marquis back and let them know that, you know what, this person is being readmitted, whether it's to the hospital or it could be directly readmitted to Marquis community.
Right.
Yeah.
Oh, that's excellent.
Yeah.
That is excellent. And maybe we could just take a step back, because I'm not sure if a lot of people know that dementia is the umbrella, and then you have Alzheimer's. So there's dementia, which is how would you explain it? I mean, there's like 200 other kinds of dementia.
There's so many kinds. I do training all the time for professionals, and I think that's the one fact that people can't believe, that there's hundreds of different kinds of dementia.
Right.
And today we hear a lot about Alzheimer's disease, and I think there's a misunderstanding of whether, you know, does my mother have dementia or does she have Alzheimer's disease? Right. A lot of times some medical conditions or infections can present themselves as Alzheimer's, like a
urinary tract infection.
Urinary tract infection. A lot of times I'll get adult children calling me and say, I think my mother has Alzheimer's. I'm like, has she been diagnosed? And I'm like, no, she's just forgetting this. And I said, has she been tested for a UTI? And they'd be like, what does that have to do? Right. Has a lot to do with it. So, you know, Alzheimer's is a disease, and dementia is a contraindication. So dementia is cognitive impairment, and there's various forms of reversible dementia and irreversible dementia. So reversible dementia can be something like we just talked about, like if somebody had a UTI, maybe someone is dehydrated, someone who's just gone under surgery and been put under general anesthesia. They wake up, and sometimes, you know, that they can be present as dementia. And then we have the irreversible types of dementia, like the frontal temporal lobe dementia, vascular dementia, and those are irreversible. But I think one thing that families are challenged with is when they do, you know, have a fresh diagnosis of Alzheimer's disease for their loved one, that the disease is, you know, they categorize it as a long goodbye, because the duration of Alzheimer's disease can be from 7 to 20 years. And just think, if you are a young adult daughter and you have an elderly mom or dad who you're trying to help, and you still have to be a mom, and you have to be, you know, you work, and you have to take care of mom or dad, and it's not a disease like that has, you know, a time limit on it. You know, it can be, you know, and it's a decline. So as symptoms get worse, you know, the challenges, you know,
safety-wise also.
Safety-wise, absolutely, yeah. You know, the number one reason that our seniors go to the hospital is not taking their medication. Number 2 is a fall. If, you know, unfortunately the statistics show that if you're 80 years old and you have a fall, 1 in 3 of those falls result in death, which is really scary. Because a lot of these falls can be preventable. It's just ensuring that the home is safe. And sometimes, we come in as adult children and it's very normal to us, or it's very familiar to us, but you almost have to be like an inspector. You have to put an inspector hat on and look as to like what are all the risks, from rugs to, slippery floors, to changing in the rug and the threshold and the color on the floor, and is it well lit? A lot of stairs, and again, just even maybe chairs, and how getting out of a chair can result in a fall, and what would be the safest way. And we have a lot of our clients who need ambulation devices like walkers and canes, and of course when they're home they don't seem to use them because they hang onto the walls, and that's not safe as well. So I think as the caregiver, adult children, that we really have to open our eyes to really trying to prohibit these risks from being apparent in homes.
Absolutely. So when your staff goes over there, they will like take a look around and make sure that everything's safe and
and that really happens when if when someone comes on our service, they typically meet with me, and I'm going into the home or I'm going into the rehab. But if I'm going into the home, I definitely make suggestions, but my nurse definitely goes into the home and she makes all kinds of suggestions. A lot of it is the rugs, just throw rugs on the floor, slippery tiles in the bathroom.
Make sure they have railings.
Maybe you need to have a heightened toilet seat. These are all things that are so easy that can really have a big impact on keeping our loved ones,
at home,
keeping
and
them
quality
safe.
of life, definitely.
And I think what our job is, our main focus at Right at Home is to add life to the years that our clients have. Everybody says it's add years to life, but ours is to add life, quality of life, to years that they have left.
And you do a great job at that, because you're out in the community, and I am too, and you're always doing stuff with the seniors. And like myself, we like to tell them about all the different options that are out there. That's how I started doing the show, to let people know, because I don't think a lot of them I know, they do not know they have choices. They think that they have to be told they're going to use X, Y, and Z, but that's not the case.
Right, and I think here's the thing. First and foremost, everybody wants to go home. I know when we, when we go to see, patients at a Marquis Health Care and they're transitioning home, we're not only working with them, but we're working with your discharge planners, and my nurse goes in and, we attend a discharge planning meeting, and we're making recommendations to the family. And a lot of times families, whether they need just a little bit of care because they're really doing a great job, or they need, round the clock care, that's what we can do. And the great part about it is when they start with a care plan, it's always going to change. So we have great discharge programs that take into consideration specific diagnosis like COPD, CHF, congestive heart failure, or if they have Parkinson's, or if they're diabetics, and we work with them so that our clients come on our service, and they may start out with a 24/7 or overnights just to help families, but then as they progress and they get better, we can transition the schedule down so that we're there just to ensure safety, to get what we need to get done. So it's a win-win, and I've never met anybody who said, oh, I want to go back to the hospital, or what I mean. They love being when they can come home, and they love that they know when we come to a Marquis Health Care and a community, we see them, they know that we know where they were, and they know that if my nurse has to make a referral back, talk to the doctor, she's going to tell them that they were in Marquis, and that if we can do a direct admit back, because it's great for the patient. They're familiar with where they were before starting the whole process over in the emergency room, right?
Absolutely. And I know you are on site at a couple of places,
so we have 3 offices where we, Right at Home offices, and then we are on site in 3 independent living communities. So we're at Nichols Village in Groveland, and Colonial Gardens in Beverly, and Shore Village in Lynn. And these are all independent living, so we share the office with VNAs so that we can provide a continuum of care. And we have aides that are dedicated to the buildings. And what's great about doing, providing service in those venues is we can do as little as 15-minute.
Right.
And in that 15-minute, what do we do? Maybe it's a matter of a med reminder,
Right.
or maybe it's just making sure that someone has done their finger stick and recorded the number for taking their sugar. So that's a great way to keep them independent. But what happens is when they do end up with a health episode, they go to the hospital, and they know that I know you've done a lot of great things in our communities as well, and they know you. So it's been great because they see you, they know you, and then when they're there, not only are we checking up on them, but they get to see Karen, who they adore.
It's all the continuum of care, right?
Yes, exactly.
So we're here to really help people in the community.
Yes, yes. I mean, I think when you think of the statistics just on Alzheimer's disease, that as we age, age is the biggest risk factor for contracting Alzheimer's, and it's like 80% of people over 80, can have some form of cognitive impairment, and it's a 50-50 shot whether they will have Alzheimer's. So I think getting the word out and understanding, whether you have a diagnosis, whether you're into the long duration of a diagnosis of, what's great is Massachusetts has just become dementia friendly. And what does that mean? That means that, key people in the community are trained so that your loved one could go out to dinner. And some of these restaurants, they're called a purple table, where the table has a purple tablecloth and there's a special menu, so that it's all about engagement. It's all about letting families come and feel normal, in a really difficult time.
That's the whole key. I think feeling normal. I've seen people, they have a card, like a business card, but it will say, my loved one has cognitive impairment, and give it to the waiter, so that there's not a big scene when they're going to order and they don't know, and just making people more comfortable and having that normalcy again.
And in the community, they've trained first responders, the banks, they've trained all kinds of establishments, business community, so that they can be aware. And another thing that's really great is we've started memory cafes. So memory cafes are like a safe space for not only the person who presents the dementia, but their caregiver, loved ones, spouse. And we run 3 of them, and I have to say, it is so wonderful. They're typically in churches or the senior centers, and there's over 87, I think, in Massachusetts, and there's a registry, so memorycarecafe.org. You can go on and see the registry for where they are. Most towns have them. And what we're finding is, like our memory cafe, we run one in Marblehead, and some of the people who go to the Marblehead one also go to the one up in Newburyport. So, if you needed to take a look, and it's something great, especially with the weather, being so nice now. And what is a memory cafe? What do we do there? Well, it's as much fun for not only the caregiver as well as the loved one who presents dementia, because we always have always great refreshments.
Absolutely.
And we have great activities. I can tell you, we've had Judith Black, who's done storytelling. She's amazing. We've had Nancy Van Boschen from Arte Rehab, who's come and done watercolor paintings. We've had the residents at Vinnon Square come, and they have done amazing, like trivia. They've made bird feeders, and it's wonderful. But for the caregiver, it's a time of, we have a lot of resources there. They can communicate and engage with other people in the same situation while their loved one is there. It's learning what's available in the community, other programs. So we're really proud to run the ones that we do, and it's just an honor, when, it's very, you don't have to RSVP, you walk in, and it's a great hour and a half. And I have to say, it's something I'm very passionate about.
Well, we have to put me on the schedule, because I have been to a lot of them. I've painted scarves, and I have to tell you, just to see the 2 people doing an activity together, like a meaningful activity, maybe they haven't done anything in years, and to see that, it's very heartwarming. Well, it really is.
Yes, and I can say you did a great job at our community in Colonial Gardens. She came and brought the activity of painting scarves, and it was the most well-attended activity that they've had. And I walk into the community all the time, and they're all wearing their scarves, and they come up to me, and they want to know, when is she coming back?
But I think I've painted 2,000 scarves now, I'm telling you.
it's amazing, but it's just a matter of, what a great, when we were sitting in Colonial Gardens that day, we had so many people say, I don't know how to paint, I don't know what you're doing. And we're like, just sit, we're going to tell you what to do. And then it was just like magic.
It really is.
They were so excited, and they didn't want it to end.
I know.
And it was
I
really...
love that activity because it
Yes.
also puts people at ease. It's not
Yes.
just really about the scarf painting. They're able to ask questions that maybe they wouldn't normally feel
Sure.
comfortable. I mean, there is, I think people think it's a little stigmatized when your loved one has Alzheimer's or dementia. They're a little afraid to talk about it. Sometimes in the beginning, people don't want to admit it, acknowledge it, or talk about it. So when I do something like that, it puts everybody at ease, everybody's
Sure.
just relaxed, and people are more apt to ask questions.
Absolutely, and I can even share a really great story about a memory cafe. It was our first or second memory cafe, and we had someone came in, and the woman, she didn't want to take off her coat, she didn't want to be here, and it was fine. We let her keep her coat on, and then we had a great someone was doing storytelling, so they just showed 2 pictures of 2 young little girls sitting on a wood fence, like whispering in each other's ear. And all the question was, who are these 2 little girls? What do you think they're whispering about? And this woman took over the whole conversation, and she actually relived the love story with her and her husband was sitting right there. It was beautiful.
That is so sweet.
Yes, so sometimes when you got to give it a little time, like you said, and but the family couldn't. They were like, if we didn't see it, we would never have believed
And
it.
how special is that? You and I see things like that all the time.
We're blessed.
I mean, that really.
Absolutely.
That's
Absolutely.
awesome.
Absolutely.
So, anything new on the horizon?
Well, the one thing I can tell you is we're continuing to roll out our Dementia Live CEU training. And that is for CEUs for case managers, nurses, and social workers. But we also train assisted livings, rehabs.
I know we're going to be having one.
I know we train staff on the actual sensitivity training to dementia. So it really puts them in the shoes of what it's like to walk.
It's pretty amazing. For somebody who hasn't done it, I think it's been around for a while, so people have heard of it, but maybe you could just explain what it is to people that don't know. It's one of my favorite things, really.
Yeah, it's sensitivity training involves, we garb you up. So what does that mean? We put glasses on you that distort your vision. They sort of mirror macular degeneration. We put bulky gloves on you that can, provide, a deficit to your fine motor skills, as well as we put headphones on that just have, just sirens, all kinds of noise.
Yeah.
But it's always amazing when we do this, and then we ask them to do 3 simple tests at the table.
Right. So you have all this on. You're in a room that's all set up. I have done it, so I know.
And you ask to go in the room, and you have to do these 3 tasks. Set the table, fold the towels, find the 3 pair of socks.
Right.
And it's amazing when they go in there, and the first thing, like, I don't know what I'm supposed to do. And it's interesting because afterwards what we do is we really, we provide some great empowerment tools, and we discuss it, and it's, we say, what's the one thing that you could take away from this to help you better serve your patients or your loved ones? And they're like, empathy, sympathy, and one task at a time.
Right.
I think being in healthcare, we're very task-driven, and we understand tasks need to be done. But wouldn't it be great when you have a loved one or a patient or a client who's resistant to care, if you could get them to participate just in rearranging how we ask them to do those tasks, or the way that we get to have them do the tasks. And it's been great. We've put over 8,000 professionals through dementia training. We actually won an award through North Shore Elder Services on it, and it still remains our goal, because our new training, Dementia Live, really, it's dementia. It's the dementia training 10 years improved with all kinds of research and development and all of that. But what's really great is there's a lot of takeaways. How do we obtain positive outcomes, whether it's a family member or whether it's a patient or a client or whatever? How can we provide positive outcomes? It's really in us learning. You know, it's really us learning that, you know, there's not a lot of, you know, asking lengthy questions. You know, I always say there's three answers to everything. There's one answer you never say is no, but there's three answers to every question, you know, someone with dementia asks you. There's, you know, in a minute, yes, and, you know, tomorrow. And, you know, whether they ask it all the time or right, you know, consecutively, you know, repeating themselves, that's fine. But as soon as you say no, you're going to trigger a reaction.
Exactly.
You know what I mean?
Exactly.
I mean, we've helped nurses who said, you know, I have a patient who, I adore this patient, and she really keeps asking me the same question every time I go in the room. Is my mother dead? Is my mother dead? And, you know, just, it's very sad. And you know what? It's very sad for the nurse who really wants to, you know, she's got to do she wants to take care of her. She feels, you know, sad and empathy, and she wants to help her. And it was just a matter of, she knew because of her history that if she did find out, it could, you know, it could likely result in a, you know, a psychotic break or something really bad. So she was stumbled, and I said, you know what, why don't you just go in there and say, let me find that out for you. Right. So she went in, and it was the next day she walked in and she asked, she goes, let me find that out for you. She said, and then I got to stay in there and really, because she goes, okay, great. And she may ask 2 or 3 times. Right. She actually emailed me after the training to tell me that that was awesome. Really helpful. So it wasn't like a major answer, it was just not no. You know, and sometimes we stumble. You know, even with choices, you know, not giving a lot of, we give 2 choices, you know, not what do you want for breakfast?
Right. Do you want eggs or toast?
Exactly, exactly.
Yeah. Well, that's great. I know you help a lot of people, and a lot of it is like first responders. They have had a lot of training, but everybody can use a refresher.
Absolutely.
We forget. I mean, I know there's sometimes people present and you don't even know that they have Alzheimer's or dementia. It's when you start talking to them for a little bit and they might get on a loop and you're like, wow, I didn't even realize it. And I'm in the field.
Sure.
So you can imagine people that aren't, you know.
Just like in Memory Cafe, until someone comes or we start an activity or somebody starts talking, you don't know, because there's no face to dementia and Alzheimer's.
No, there's not.
Yes.
Well, I think you do a fantastic job.
Thank you, Karen.
And maybe you could tell people how they could get in touch with you.
Sure. So if you're interested in learning more about home care, and you can call me directly, and I'll be happy to give you my phone number, 781-548-0017, or you can reach out to me on our website or on our Facebook page. I can come and speak with you about loved one. There's no fee. There's no obligation. It's just our time to meet. A lot of times people don't want to do it over the phone. They're rushed. They're in the car. They don't have a good cell service. Just call me and set up a time. I'll come right out and meet with you. Or if your loved one happens to be in a Marquis community, you know, you can call me and I'll meet you there. Love to always see Karen. But that's my job, to meet in person.
Right.
A lot of our families don't have the luxury of being local, so we also have the ability to put service in place remotely. So it's, you know, we can do it through internet and all of that. So it's pretty simple, but just reach out to me and we'll find out the best way that they want to proceed, and it'd be my pleasure to do that.
Fantastic. And I can't wait till our Dementia Live training. We'll be having that soon.
Yes.
And I just want to thank you so much for coming on and letting everybody know about the different choices out there. You do a fantastic job. I'm so glad you're my friend.
Me too. Thank you so much.
And thanks for coming on the show. And thank you, everybody. If you have any future ideas or topics that you'd like to hear, we'd love to hear from you. And have a great day, and we'll see you next time. Thank you.
The bottom line is it was the absolute right choice to go on board with Right at Home.
Right at Home truly gives me the right care.
Right Care is Right at Home's unique approach to home care. Quite simply, it's the right people doing the right things the right way for the right reasons. We provide the personal care and attention of a friend. We are passionate about helping seniors and disabled adults.
We are very blessed from a Right at Home system perspective. We have great franchisees, great office staff, and great caregivers. And we're very lucky to have that local presence and owners that are very passionate about what they do.
With Right at Home, I get some respite from some things to go on out and just do silly things for me.
Our services are unreal. We change someone's quality of life every day.
Right at Home provides the care our clients need when and where they need it. Right at Home offers comprehensive care options. We're very flexible with their scheduling. We're available 24 hours a day, 7 days a week.
I've had a good relationship with Right at Home. They're very, very professional. You could count on them. They were dependable.
The
The right approach starts first with the free, in-home, thorough assessment. That assessment leads to a personalized care plan that's managed by care professionals. We then match clients with caregivers that complement their needs and interests. Our office professionals supervise the care that's being provided and then communicate regularly with family members and clients.
We look at every case based on the individual needs of the client or the individual situations that a family needs to accommodate as they're trying to care for their loved one.
I'm allowing families and their loved ones to be able to live their lives to the fullest.
We've got each other, and we have help from Right at Home, and things are going quite well.
I'm so glad that I can stay at home. I couldn't imagine leaving my home.
We have the right mission, which is to improve the quality of life for those that we serve. We transform the lives of seniors and their families. Our clients receive the best possible experience and their families gain peace of mind. We help seniors stay in their home and age with dignity and respect.
The right care, right at home.